The cardiovascular system. The first thing that we're going to talk about is hypertension, which is the #1 cardiovascular disease that's seen in the geriatric population. And this is defined as a diastolic blood pressure that's greater than 90 or systolic blood pressure greater than 140. But the standard in recent times has also shifted a little bit, and if the patient does not have diabetes and is 65 or older, then 150 is also going to be acceptable, and they will not be diagnosed with hypertension until they have reached that level. In the elderly population, oftentimes the diastolic blood pressure will decrease and it'll be a lower number, and they oftentimes, when they are diagnosed with hypertension, it's isolated systolic hypertension. So that's going to be that greater than 140 or 150 depending on the other issues that they have going on. High blood pressure occurs and causes higher resistance for your heart to pump against, which can cause a multitude of other cardiovascular issues such as heart failure, causing backup in the lungs or the periphery, congestive heart disease, AFib, myocardial infarctions, and strokes. And when diagnosing hypertension in the elderly, there must be at least 2 separate occasions when the patient has either that diastolic blood pressure that's greater than 90 or that systolic blood pressure that's greater than 140. Next, we're going to talk about heart disease and heart attacks. Heart disease can occur from a variety of different things, such as uncontrolled hypertension, atherosclerosis, and obesity. And heart disease is more prevalent in African Americans. Therefore, it's very important for African Americans and elderly to get their heart checked often and have a doctor that is going to run lab values for them and to keep tabs on how they are doing. And myocardial infarctions often happen to those who have hypertension and do not manage it, or those who have high cholesterol. And once you get 75 or older, actually heart attacks are more commonly seen in women. But a lot of times they go undiagnosed or unseen or unnoticed because the symptoms for women are different from men. Men have the gripping chest pain, that crushing elephant on their chest, and the radiating jaw pain and left arm pain, whereas women mainly feel nauseous and they have fatigue. And so, if the blood flow is completely blocked, that is when infarction is going to occur. Tissue death is going to occur. But there are many ways to prevent these precursors early on, and we're going to talk about that as we go on throughout these slides. Next, we're going to talk about heart failure classifications. Heart failure is whenever there is a backup of some sort because the heart is trying so hard to pump against these high pressures, but because of these pressures within the arteries, it's harder for it to pump out. So there's class 1, which is asymptomatic. People who have class 1 heart failure, they don't really have any limitations with their physical activity, and as long as they manage it, they'll be fine. Class 2 is a little bit different. They have slight limitations of physical activity. They're comfortable at rest, but an increase in activity may cause fatigue, palpitations, dyspnea, or inguinal pain. Class 3 is marked limitation in physical activity. They are comfortable at rest, but ordinary walking or climbing stairs can quickly trigger these symptoms of fatigue, palpitations, dyspnea, inguinal pain, and substantial periods of bed rest are often required for them to be rested and feel good again. And then class 4, which is the worst kind you could have, is they're basically permanently bed rested and they don't really have the ability to carry out any physical activities without discomfort or severe symptoms, and they have chronic shortness of breath. Next, we're going to talk about AFib. And AFib occurs in over 30 million Americans, and it more commonly occurs in older adults. AFib is caused by advanced heart failure, diabetes, alcohol abuse, heart disease, hypertension, and thyroid disease. And it's defined as a rapid or irregular heartbeat. And this often occurs because of those preceding factors that we talked about. And a lot of times in the elderly, it goes unnoticed until they listen to the heart with some auscultation when they go in for a checkup. But this can be very dangerous because it can lead to a blood clot formation and potentially strokes due to the pooling in the atria. We're also going to talk about heart failure. We talked about the classes earlier, but there are two types of heart failure. There's left side and there's right side. Left side is defined as failure on the left side, but it causes fluid backup into the lungs. That is where the fluid backs up. In the right side, it's going to back up into the periphery, which is going to cause peripheral edema. Heart failure occurs, though, when injury happens and thickening of the myocardium also occurs with that. Because of the thickening of the myocardium, the heart has to work harder to pump, which causes the ventricles to thicken, and that also increases the arterial pressure. The heart, like any other muscle, eventually gets tired and no longer can adequately pump to the body, causing either backup to the lungs or periphery, or both. Next, we're going to talk about the assessment that goes along with the cardiovascular system. This is very important, as we learned in assessment 2 semesters ago, that the cardiovascular system, if our heart stops, everything stops because it's pumping blood and carrying oxygen to all our vital organs. So it's very important to get a thorough history whenever you are assessing the cardiovascular system. You want to know about any previous events or illnesses related to their heart, blood, circulation, and you also want to know family history. A lot of times heart attacks run in the family, or heart failure runs in the family. So you want to know about these things, take note of it. Also, it's very, very important to monitor the vitals of these patients because, like we said, it takes at least 2 different occasions of you taking their blood pressure to diagnose hypertension. And we saw in the earlier slide that hypertension can lead to a variety of other heart issues, and so therefore it's very important to monitor their vitals and also teach them how to monitor their vitals. Teach them what a normal diastolic range is, what a normal systolic range is, so that they can take those tidbits of information with them when they go home and that they can monitor their own blood pressure. You're also going to auscultate heart sounds like we talked about on the AFib slide. A lot of times things like dysrhythmias and AFib go unnoticed until you listen to their heart and you hear the differences. And then you're also going to check pulses. You want to make sure that they are getting blood flow to all of their limbs and that the pulses are strong. And then you're going to check their color. You're going to make sure that it's appropriate for their ethnicity and that they are getting perfusion throughout their body. Next, we're going to talk about some interventions that we as nurses can use to help these patients who already have cardiovascular issues, or ways to be able to identify a heart attack or a stroke. So the main thing is we're going to teach them signs and symptoms about heart attacks, especially if they have a family history of heart attacks. It's very important for them to know these signs and symptoms and know that the quicker that they respond and they know these symptoms, the faster they're going to get treatment and the likelihood of a better outcome. Because we do not want tissue death to occur, and that can happen very quickly. So we want to teach them of that crushing chest pain if they're a male, and the radiating to their left side of their arm and their jaw pain. We want to teach them that. But for women, we really want to teach them the signs and symptoms because for them, it's a lot different. It's fatigue, it's nausea, maybe a little bit of chest pain, maybe some palpitations. But we want them to know that if these symptoms do not subside, that they could be having a heart attack, and it's better to be safe than sorry and go get checked. Also, we want to teach them about healthy eating and exercise, about a low sodium, low fat diet to monitor and to control their cholesterol before it gets high so that they don't have to worry about those things as much so that they can prevent them. We also, like we talked about in the last slide, we're going to monitor those vital signs. Regardless of if they have hypertension or not, it's very important to monitor that because in the elderly, hypertension is very common, but we want to give them medications, we want them to exercise, we want to be able to regulate that blood pressure so that it doesn't lead to other cardiovascular issues. And then we're going to monitor their cholesterol. We don't want them to have atherosclerosis, we don't want them to have hypertension because they just don't know how to eat properly. We want to monitor that. Lastly, we're going to talk about education for these patients. We want to educate them on prevention, but also on management. But it's so important to prevent these things before they happen. We want to prevent hypertension and heart failure and heart disease if we can. So we want to teach them, our patients at a young age, that exercise is important. Diet is important. Going to the doctor and having your heart checked is important. Having labs tested and ran often, especially our LDL and our HDL. And we want to teach them to monitor their blood pressure at home, go to a CVS, or go to the doctor's office to have that managed. But if they already have issues, these are all important in managing it too. We want them to have an exercise plan that fits them and their lifestyle. So if they can only walk once a day, we want them to walk once a day. And we want them to have a low-fat, low-sodium diet. We want them to regularly get checkups, have their lab values ran as well, and also monitor their blood pressure at home, especially if they have hypertension, and to write these numbers down and take them to their doctor's appointments as well. So from my presentation today, I hope you guys realize that it's very important to take care of your heart because from that flows the life that we have. So here's a couple pictures of some cute old people who've just lived life well. So I hope you guys enjoyed my presentation. Here are my references I use, and I hope you guys enjoyed it. Thank you.